So the numbers that you will see today, I believe, will be under this new reporting system. On April 5th of this year, the Council of State and Territorial Epidemiologists, known as the CSTE, put forth new case surveillance recommendations. The CSTE is a national organization made up of member states and territories representing public health epidemiologists, scientists who study infectious diseases and their spread. The CSTE provides technical guidance and assistance to the states and to the federal partners, such as the Centers for Disease Control, the CDC. CDC has now recommended that states follow this. Up until now, before this change, the guidance allowed doctors to count as COVID-19 cases only those that had been confirmed by a laboratory test. Only those that had been confirmed by a laboratory test. So when you saw the numbers that Dr. Acton was reporting, that was only those cases. The new guidance was developed by a committee of state epidemiologists from Idaho, Alabama, Iowa, Hawaii, Michigan. Is now a formal recommendation from the Centers for Disease Control. It will include cases that meet the following criteria. And let me just say this and I'll say it again. We're going to be reporting this, the old numbers, or what would have been the old numbers, the old method of coming up with these numbers. We're going to then report at the same time what comes under the new numbers. Then we're going to put the total. So those, anybody looking at those will be able to see that. And I want to go through and explain what the new number that you're going to be seeing there every day, what that actually represents. Quick tests, let me start with quick tests, that have determined the presence of COVID-19 antibodies in the blood. These are the rapid tests that will soon be coming to Ohio, where doctors can prick your finger, check your blood for antibodies, and have a result within minutes. Under the old guidelines, if they had not been changed, those tests would not have been reported positive. You would not have seen those numbers. So this is evolving. The science is evolving. The way of counting is evolving as well. So we would not have been allowed to count people, or would not have been told to count people, who test positive for antibodies that they had not, if they had not previously had a lab test confirming the presence of COVID-19. So this new method of testing will show up in the second number. And without this new guidance, it would not have shown up at all. Again, a new way of testing. This new number will also include the following. A person will be counted if there is clinical evidence and epidemiological evidence of the presence of COVID-19, and when there is no other likely diagnosis, even if there's no laboratory test. So in this case, no laboratory test, but there's clinical evidence and epidemiological evidence of the presence of COVID-19, and there's no other likely diagnosis. That will be the standard that the reporters will use. The reporters, the medical professional people. This means that doctors in hospitals or outpatient facilities may determine that someone has COVID-19 based on his or her symptoms, such as fever, cough, pneumonia, along with a history of possible exposure to a confirmed case. An example might be a person who had all of those symptoms, who was living in a nursing home that already had confirmed COVID-19 patients. Now, as we report our data moving forward for deaths, we'll have the following numbers. Confirmed deaths, which is under the old category, new CDC guidance deaths, and then we draw a line and we'll add the two together. By the way, the National Center for Health Statistics, which is part of the Centers for Disease Control, in their death reporting for COVID-19, it's my understanding, is now reporting probable deaths in those numbers. So what this new guidance enables all of us to do is to better track who has the virus currently and those who have had the virus, those who are recovered, those who are no longer a threat in passing it along to others. Using this guidance will be instrumental in helping us trace the spread of the disease and eventually isolate it to smaller pockets or areas so we can open things back up again. At the same time, it will allow us to target limited resources for a better public health response. So again, the way we are going to report this data is going to enable people to compare these numbers as they change, but people are going to know what each set of numbers actually represents. We think that for Ohio citizens, this is the best way to report this. We are going to follow what the CDC has said, and we will do that, but we will break those numbers out.